I've just checked the orders on Mrs. Joseph, and she has a lavage ordered on her NG tube. I have gathered all of my supplies that I needed, and I've washed my hands. I've come into the room, and I'm going to go ahead and clean my table off with an antiseptic wipe. And while I do that, I'm going to make sure and explain the procedure to the patient so they know exactly what's going on, and make sure that she doesn't have any questions. I'm going to wipe the table off and the sides and get rid of that, and allow it to dry for a minute while I finish explaining anything to my patient. Then I'm going to take the equipment I brought in and put it on the table. And the first thing I'm going to do is, once I get that all set up, is I'm going to go ahead and take my hands and wash them, get it all cleaned up, my patient. And I'm going to go ahead and put some clean gloves on. Go ahead and get started. I checked the patient's x-ray, and she had one done about 4 days ago, which showed that the tube was in place properly. I'm going to go ahead and, since it's not hooked up to the suction now, it's being clamped, I'm going to go ahead and check for gastric contents. I'm going to take out the clamp, and I'm going to pull back, and I just get a couple of drops and need resistance on that. So what I'm going to do is I'm going to just go ahead and check placement by putting some air down the tube, about 10 cc's of air in my syringe. I'm going to put it back in there, and I'm going to get my stethoscope and listen over their abdomen for the swoosh of air. I'm going to take that and put it on her abdomen and put in a swish of air, and I heard that. So it seems to be in the right place. So I'm going to go ahead and proceed with the lavage. So I'm going to take this off and reclamp it while I'm waiting. I'm going to take, and you can use tap water or normal saline. And I have normal saline here. I'm going to take it and pour it. And I was ordered to lavage it with 100 cc, so I'm going to make sure and put at least that much into my container. I'm going to go ahead and draw up that. So I have a 60 cc syringe, so I'm going to pull up that amount. Go ahead and open my tube. Insert my syringe, and I'm going to monitor my patient for any problems that she might have, or have her tell me any problems that she might have while I'm inserting the solution. Monitoring how she's doing, any problems, anything going on with her. And she seems to be doing just fine. Take this, clamp it. In, and I still need 40 more of the solution, so I'm going to draw that up into my syringe. Once I get that, I'm going to go ahead and put that down the tube. Again, continuing to monitor my patient for any problems or issues that she may have while I'm doing this. She says everything's going okay. So once I get the solution in, I can do one of two things. I can set her back up to the suction to see how much of that 100 cc's will come out, or I can gently pull back, which I'm going to do. I'm going to gently pull back and get as much of the solution I can out without meeting any resistance. I'm getting quite a bit of it. I've got 60 out now, so I'm going to go ahead and clamp the tube. Get rid of this. back into the tube and see how much more I can get out. Reinsert it and pull back. I am meeting some resistance. I'm gonna get about 20 more out, and that's about all. Okay, so I have put in 100 and I've gotten back 80, so there's gonna be 20 milliliters of solution that I'm gonna have to add to her intake because I wasn't able to get it out. So once I'm all finished with that, I will document the procedure that I did on her and document on the I&O what I wasn't able to get back.